We will allow gyms, fitness centers, bowling alleys, body art studios, barbers, cosmetologists, hair designers, nail care artists, estheticians, their respective schools, and massage therapists to reopen their doors this Friday, April the 24th.
Finally beginning to open up Texas and other states because it's been long overdue. You know, they told us, Tucker, to follow the science. Well, what science? I mean, at the end of January, Dr. Fauci, who I have great respect for, said this wasn't a big issue. 3 weeks later, we were going to lose 2 million people. Another few weeks later, it was 1 to 200,000. Now it's under 60,000. And we've had the wrong numbers, the wrong science. 500 people out of 29 million. And we're locked down. And we're crushing the average worker. We're crushing small business. We're crushing the markets. We're crushing this country. And what I said when I was with you that night, there are more important things than living.
Every one of those lives is a tragic loss. But when you count 150 versus 2.3 million, you have to say, we have to open up. We have to go back. Our bus drivers, our
But hasn't it been because of social distancing that the numbers have been what they are?
How do you know until we have a control group? We offer to be a control group. Anybody who knows anything about statistics knows that, for instance, you have a vaccine.
You're offering
the
citizens of Las Vegas to be a control group to see if your theory on social distancing works or doesn't work.
Wrong. Absolutely wrong. Don't put words in my mouth.
Supposing we hit the body with a tremendous, whether it's ultraviolet or just very powerful light, and I think you said that hasn't been checked, but you're going to test it. And then I said, supposing you brought the light inside the body, which you can do either through the skin or in some other way. And I think you said you're going to test that too. Sounds interesting.
We'll get the right folks who could.
Right, and then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning, because you see it gets on the lungs and it does a tremendous number of the lungs. So it'd be interesting to check that. So that you're going to have to use medical doctors with. But it sounds interesting to me.
Welcome to Planet Stupid. I'm Barry Gordon.
And I'm Andre Coleman.
And this is NewsRap, live at 5.
Drums.
That was a lot of stupid. I mean, I had to have the guys put that together because, and there's even more that we could show there. I mean, but that was kind of the most insane that we could find.
You know what? It's so much stupid, Barry, that I feel like we've already talked about it. That's how dumb it actually is. It's almost like, you know, you see it and you go, it's so stupid, you feel like you've already had the conversation about it.
Yeah, I get that. I definitely get that. You know,
what was the part of this that just blew you away?
Oh, Goodman, you know. I offered Las Vegas to be a control group.
I'm not a casino owner.
Did you ask Las Vegas? They wanted to be a control group. I mean, the biggest problem with all of this are that these orders that the governors are doing are saying to the local governments, you have no choice.
Yeah.
You have to open whether you want to or not. So the mayor of Atlanta, what's her name, Mayor Lance Bottoms, Keisha Lance Bottoms, is basically saying, I can't do anything about this, but people stay home. I mean, that's how she's handling it. Because
well, the people still have the power to stay in their homes and not spend their money.
Power.
You know, the people still have the power to stay home, not spend their money, and to decide when they are ready to leave their homes.
Well, they were showing, you know, barbershops that normally have 35 people with 3 people. Now, there's a real question about that, because is that going to sustain the barbershop owner?
No.
If it stays that way, no. I mean, he's going to probably spend more money opening the shop than he is, I mean, and that is going to be happening, by the way. I hate to give all bad news, but that is what is going to be happening for months after we open this economy. Months. And people are going to be working at 50% capacity or 60% capacity. And that's a major drop in income. And a lot of economists, that's why a lot of economists say, no, it's not going to be a rocket.
No, not at all.
Says it's going to be we're going to be limping toward some semblance of normalcy.
That's
for a very long time now.
I think the key is some semblance, because this idea that it's just going to go back to what it was before. They are even talking about. I mean, California, the superintendents are talking about how do we reopen schools come August, September with social distancing. There's even some talk of having two sessions of school a day. Half the kids go in the morning, half go in the afternoon. How do parents deal with that? If you go back to work. So there's so much of this that needs to be worked out. It's one thing to send everybody home and say work from home and sadly see people get laid off. It's another thing to say everybody go back to work, but now we have to split work days. We have to split school days. That's going to be hard for people to adjust to.
That's right. That's right. And it's hard right now. I mean, we have a message from Sarah Greco, our friend in New Jersey. And by the way, I really feel for New Jersey right now. They just passed the 100,000 case mark, which means that they're the only state in the country other than New York to pass 100,000 cases. Tremendous number of cases. And Sarah Greco writes, after a day trapped in the house with 2 kids, I especially look forward to your show, which is very sweet.
Yeah.
We just want you to stay safe and stay healthy. Because this isn't a joke. I mean, there were two things that drove that home to me, Dre. One was that I was watching a show called Tommy. It's a new television show on with Edie Falco. And I was watching the show, and there was a character actor in it named Mark Blum. And at the end of the show, they put up a picture of Mark Blum. And it says, Mark Blum, 1950 to 2020. And I looked up, and yes, he died of coronavirus, based in New York.
Wow.
A preacher, Bishop Gerald Glenn, who had gotten some news attention because he said that he was going to open his church, New Deliverance Church, and he was going to open that up and urge his parishioners to come, and 2/3 of them, about 2/3 full, and he told them to stand up and show that they didn't care and that God was greater than the virus, and that he would keep preaching until he was either in jail, I guess, thinking he'd be thrown in jail for violating the social distancing guidelines, or in a hospital. Well, he ended up in a hospital, he ended up on a ventilator, and he ended up dead. So God may be great, but it didn't help him any. So, this is real, people. I mean, this is frighteningly real. This isn't a joke. This isn't a drill. This isn't a test. This is happening now. And if we've got to keep doing this for a little while longer until we get our act together with testing and with other things, we're going to have to. I'm sorry to talk so much.
And you know what? Use some common sense. Don't listen to a guy preaching at a church called Deliverance if you're in Virginia either. I mean, you probably want to avoid that.
Yeah, that's for our older viewers.
Yeah.
Yes, you might want to look up Deliverance, Dueling Banjos, Burt Reynolds. People, the younger generation have no idea who we're talking about. But yeah,
if I don't find a way to laugh through all of this, you cry.
But we have to,
and I'd rather laugh.
We
have to even just stay at home. I had to go pick up my sister, put her car in the shop. I had to go help her last week, and man, I had on more masks and I was more bundled up than Claude Rains. You'd have thought I was invisible under all that stuff.
I know, and we get so mad when we take a walk and we're walking and we see people, usually younger people, with no mask on, and we have to throw our mask on really fast. And, it's a different life, but this is a once in a lifetime event. This is not the flu. It's not a cold.
Let's hope so.
Well, yeah, that's true. I mean, it could be once in a lifetime and then twice in a lifetime and 3 times in a lifetime if we don't get it right.
Right. Let's hope that this is it. And let's hope that the nation actually gets prepared and understands and sees the flaws in our medical system and our preparedness if this comes back around. I mean, a point Joe Biden has made is really coming back to me. We can survive 4 years of this idiot, but I don't know if we can survive 8 years of this guy.
Well, I'm not sure we can survive 4 years of him, but that's another.
Well, you got a point. I mean,
but people are saying, well, where's Joe and why isn't he out there? I don't think he has to be out there. By the way, today, Trump took absolutely no questions at the briefing, at the coronavirus briefing. So
maybe he was going to get.
I think he knows he stepped in it rather badly. I think he understands that. But I want to ask you, Dre,
sure,
because I'm hearing that Garcetti is looking at, I don't know why this number's been thrown around, May 17th as a possible reopening day. Have you heard anything about that?
I have not heard about that. I know Garcetti is. I know the city of LA is looking at a soft opening at some point in May. Mm-hmm. Look, the virus is now the COVID-19 coronavirus, whichever name you want to use, is now the leading cause of death in LA County over the past month. They are averaging 44 deaths a day. Heart disease is about 31, and the flu during the flu season in LA County, it averages 5 deaths a day. Now is not the time to discuss reopening. The models
there were
have
over
us about
2,000 new cases in 24 hours in the state of California. So
exactly.
I mean,
now
we're still
the models have us, I think, through August at about 67,600 cases in the U.S. But the state's opening too soon. We are already over 50,000 deaths. Mm-hmm. But the state's opening too soon, those models are going to go up. It's inevitable.
Yeah, and the new model actually raised the numbers. It was at 60 at one point, then it went to 63. Now it's gone to 67. And I think it's because of all of these states opening too early. But I think probably the folks want to see what has been happening with Pasadena. So why don't we run the local brief?
Let's roll it.
This is your local news brief for Friday, April 24th, 2020. There are now 293 confirmed COVID-19 cases in the city of Pasadena, and 29 total deaths have been attributed to the virus. An exhibition room at the Pasadena Convention Center was recently made into a 250-bed auxiliary hospital to be used if Huntington Memorial Hospital reached capacity. The National Guard has deployed medical teams to 4 long-term healthcare facilities in Los Angeles County. Brighton Care Center in Pasadena is one of them. Last week, Brighton Care Center reported a total of 66 cases between staff and residents, making it the most affected long-term healthcare facility out of the 4 facilities receiving medical aid. On Monday, April 20th, the Pasadena City Council held a remote meeting where budget cuts were discussed. City leaders are to assess all open city jobs and ongoing recruitment offers in order to determine whether or not unfulfilled positions could continue unfulfilled or even be eliminated. Budget cuts would not affect police, fire, and public health, and instead impact city improvement projects like the Colorado Street Bridge suicide prevention barriers, streetlight conversions, and sidewalk improvements. The improvements cuts would save the city $8.5 million. In addition to the cuts, Measure I funding is to be directed into the city's general fund. Several council members were concerned that this would not be enough, calling for further conversations on additional budget cuts. City Manager Steve Mermel reiterated that although he expects future budget cuts, the city does not want to cut services before it becomes imperative. President Trump has stopped green card applications for 60 days. Trump defended his response by referring to the travel restrictions placed on China and other European countries experiencing high volumes of COVID-19 cases. Co-director of the National Day Laborers Organizing Network and Pasadena resident, Pablo Alvarado, is quoted in a Pasadena Now article as saying, "That's the administration and his followers taking advantage of this pandemic to make their dreams come true." The green card ban follows on the coattails of Governor Gavin Newsom's announcement last week of a $125 million COVID-19 relief fund for immigrants.
So, Dre,
yeah,
are the current deaths? The last time we talked, of course, there's much fewer deaths. But the last time we talked last week, and fewer cases. You were saying those cases were almost exclusively out of long-term care facilities. Is that pattern continuing, or does it seem like there's more community spread right now?
All of them are still out of our long-term health care facilities where our seniors are. And yesterday, there was one additional death to put us at 29. On Wednesday, there were no deaths. When I looked right before we came on the air, today there were no additional deaths. So our fatalities are way down. And that's hopefully because the city has issued an order mandating some rules in those facilities. I know the National Guard is now at Brighton Healthcare Facility attempting to aid them. So hopefully those things will work and the facilities will stay at a flat line and the cases will eventually.
Are they using the convention center yet?
They're not using the convention center. Huntington is nowhere near capacity. I mean, 2 weeks ago, Huntington was only at 61.
Okay.
They were only treating 61 patients 2 weeks ago. I don't know how many they're treating now. I'll check and maybe send it to Jared so they can update, maybe with a blurb or a flashing insert at the bottom. But they're not near capacity at all. I mean, testing has worked in the state, and I mean the state is seeing an amazing amount of cases, new cases every day, but it's because there's more testing available and there's a lot of backlog right now. So that's not to say that lower numbers are something to cheer, because you don't want anybody with it, obviously. But the testing is out there. The Rose Bowl now, anyone working in an essential business can be tested, and anyone with symptoms can be tested in LA County just by making an appointment.
But it has to be through a physician, doesn't it?
No, you can call the testing centers now and make an appointment.
Anyone with symptoms?
With symptoms.
Current symptoms.
Or any essential worker. If you work at an essential business, you can be tested. Okay. So, and they're opening up on average, I think in the past 2 weeks, they've opened 3 additional centers every week. So hopefully that continues, and hopefully California can stay ahead of this thing. But as far as reopening, I don't think we're anywhere close to that yet.
Yeah. So when are we going to go bankrupt?
Well, according to Mitch McConnell, we're already there, and we should just.
Yeah, I got to explain something about that, by the way, because he's getting a lot of flack for it, and he deserves a lot of flack for it. But I did a little research and found out that it's kind of taken out of context, just a little bit.
Okay.
I actually listened to the Hugh Hewitt show that he was on, and it was the idiot Hugh Hewitt who raised the fact that cities and states can't declare bankruptcy. They're not allowed to declare bankruptcy. And Hugh Hewitt has always said, well, wouldn't that be a great thing, for cities and states to be able to declare bankruptcy and get out of all of the obligations that they owe to, like, the public employee pension funds? Wouldn't that be just wonderful? And basically, McConnell was kind of caught very flat-footed and was answering that. He was not talking about the current situation about state and local governments not getting federal money. Now, he did say that he didn't think the Republicans wanted to give the states and local governments federal money. Because he said, that, which was even more stupid, because he said, well, there are taxing authorities. They can just raise it. That's really dumb in the middle of a pandemic, that now the states and local governments, in order to pay for the firefighters, nurses, and teachers and doctors and paramedics, are actually going to raise taxes. That's even more stupid, I think, than declaring bankruptcy. But
it is.
It was in answer to that question, and I just wanted to clarify.
You know, what this whole thing shows us, it's what you and I have said over and over and over. It is a crisis, and we have a president who is ill-equipped to lead us through the crisis. He tosses out stupid cures. He's talking about UV rays. I mean, like I said earlier, he thinks he's the professor on Gilligan's Island. He's trying to come up with the 5-second miraculous cure instead of going, hey, these are hard times and I have to lead you through it.
That's right.
That's what he needs to do. You cannot deny their hard times. Every adult knows it's hard, but he's saying, I'm the cheerleader. It's my job to put a happy face on it, put a happy spin on it. It's not what we need right now. We need leadership.
But he's not even an effective cheerleader.
No, he's not.
Because an effective cheerleader would actually be making us feel good. And every time he gets up, I want to shoot myself because we're not feeling good, just being lied to.
No.
And he's incapable of leveling with anyone. And it's very, very frightening. There's Sarah.
Okay.
She says, after a day trapped in the house with 2 kids, I especially look forward to your show. I'm glad about that, but I know our sound has been awful. We apologize for that.
Well, after a day of being trapped,
sounding better now
in the house with 1 kid, I look forward to doing it.
Yes, that's right. We have fun doing it, and we're glad we can continue to. So, Sarah, actually, we can't have a conversation, unfortunately, but we can chat a little bit. So, do you know anyone who has been affected with the virus? And hopefully, it's not a close relative. But
do you know anyone yet? Barry, that
100,000 cases
been impacted.
That's not a small amount of cases. So,
what about you, Barry?
Yes. Thank goodness, no one got terribly sick. There were a couple of fellow trustees from the pension plan. One, he got it. His wife got it first. Then he got it. The other thing that you have to notice about this is that there have been many, many times when I've had a cold or I've had the flu, and my wife hasn't gotten it. But the fact is, with this thing, just like the bishop, I mean, he got it, and then his wife got it, his son got it. I mean, this is so virulent that it doesn't just and sometimes it does skip. Sometimes it says, well, I'm not going to bother with you, I'll go over here. But, I mean, sometimes it does skip, but this is a very virulent bug when you're in close contact with people that have it. And,
well,
go ahead.
February, when I thought I had the flu, I mean, Sheila got it. I mean, Lauren brought it home. Sheila got it, then I got it, all really quickly. None of us ran a fever, but it didn't seem like a regular flu for me. So now when I'm hearing that this was in the U.S. a lot earlier, thank God I was already working from home at that point, right. Since the jump. I'm kind of curious myself if it went through my household in some kind of light strain, or if we all fought it off.
Well, as I said, I think last week, we thought we had it. We don't know if we did, but we certainly had virtually all of the symptoms except for the shortness of breath, heavy exhaustion. We did not have a fever very long. We fever came and went. But
I remember when you sent me the text that you were ill, and I was really worried about you at that point, because that's right around the point that the U.S. was beginning to talk about this and take it seriously. So I was really concerned about you then.
But I mean, we know of people because we know of personalities. For example, John Prine, who was a well-known singer-songwriter in the 1970s, he died from it. It's not a mystery that this is killing people.
Yeah,
and it's a very, very scary thing. So, it's miserable, and I don't know. I certainly I guess the question, and maybe we'll take this up next time, because it's the elephant in the room, is how many cases and how much death is acceptable, is an acceptable level to reopen the economy. And
I'm glad I don't have to make that decision.
None. No one wants to make that decision, but every single governor in this country will have to. Because at some point, it's not going to be zero.
Of course.
So at some point, it's going to be some number. And someone's going to have to make that decision, because we can't stay in for the next 6 months. So,
no, I mean, we will be lucky if we can get through May, and people still really following the orders the way that they need to. I mean, I'd like to say that they will, but people, it's just, we need to be outdoors. People want to get out. I'm following the order. Yeah. You and I already talked about it. I'm not running out there again real soon.
Well, I'm not. I'm 71, so I'm in the vulnerable category. So I'm not going out until they give me the all clear.
I'm black, so I'm in the vulnerable category.
And you're in a vulnerable category. That's right. And you've had a medical issue. And
I've had a medical issue before, so I'm.
That's right. So we
I
both
got 2 strikes. Yeah.
So we'll be talking like this until October. Anyway, friends, that's it for us. So what we want you to do is to stay tuned to a brand new show that premiered last week, Joe Carbonetta's Arroyo Live. We are continuing live programming from 5 to 6. But for now, that's it. I'm Barry Gordon.
I'm Andre Coleman.
And this has been NewsRap Live at 5. Stay tuned to Arroyo Live.
Have a great weekend.
Yes, and stay safe.